Back on Thursday, the Supreme Court blocked the Biden administration from enforcing its sweeping vaccine or test requirements for large private companies. They did, however, allow the mandate for healthcare workers. To talk about this ruling and its health implications, we're bringing in our 9Health expert, Dr. Coley. Good morning, Dr. Coley.
Hi, good morning.
First, what's your reaction to this ruling as a healthcare worker?
I have to say I am thrilled about the healthcare workers part because I personally know many patients who have become infected with COVID-19 because somebody on their healthcare team was positive and didn't know about it. But I'm very confused, a little upset, and very disturbed about the big businesses not also coming through. And I think it sets the wrong precedent, and I think it's going to be a huge setback in our fight against COVID-19 because, as we know, our antibodies from the first round of vaccinations are likely to go down. And if we're not mandating vaccinations going forward for businesses, the science is the same. You can still spread the infection without knowing it.
Some other questions that I wanted to bring to your attention that our viewers have are in regards to the new guidance from health experts about masks. I know the CDC has said, masks, some mask is better than no mask, but which masks are best to wear?
Guys, it's time for an upgrade on our masks. So in the beginning, when we had a PPE shortage, we were saying cloth masks, bandanas, scarves, anything that you can tie around your face. But now that we're not in that situation anymore, we have a much more contagious variant. It is really time to increase the amount of protection we get. So I am recommending everybody to wear KN95s. Or N95 masks. And those are masks that not just have a better fit, they're also a thicker material, so less porous, less likely to let particles through, but they also have, properties in them called electrostatic properties, which actually trap the particles. So think of it not just as a physical barrier, but actually a trap for small viral particles.
Right, and I know the cloth masks are such an allure for people because you can put them in the wash and re-wear them. How long can you wear N95 and KN95, and maybe how are you able to clean them too?
Great question. So, initially, obviously, they're designed for single use only for medical purposes, but they're quite durable. You probably can wear them for probably about a week or so, but the way that I make them last a little bit longer is I put a surgical mask or a cloth mask over it on the outside. So that way you can really sort of protect the external surface of the mask from getting dirty. I would not recommend washing them, cleaning them, trying to disinfect them, because doing so will actually damage that filter and that trap that I talked about, and you could actually expose yourself to risk by wearing a defective mask. So just wear it as long as you can before it starts to sort of break apart or you feel like the integrity is not as good, and then move on to another KN95 or N95.
And with a lot of people around us getting COVID left and right, Omicron is just spreading so fast. The idea and the talks about herd immunity once again has come up, and we've talked about this with prior variants, but we've never seemed to achieve it. With Omicron, what would we need for herd immunity to kick in?
So herd immunity, if you recall, means that if you're part of a herd, even if you're not, immunized or vaccinated or have antibodies, you're still protected by being part of that herd. But by definition, what it requires is that, number one, you can't get reinfected. So you cannot catch that infection again. And number two, once you have those antibodies, either through natural infection or through vaccination, you cannot spread it to somebody else. So we still have a bit of a question mark when it comes to Omicron, whether herd immunity is going to kick in, because we don't know those two properties. But the good news is, based on what we're seeing on the East Coast and some other countries, we've already started to see some of those cases go down, suggesting that there probably is some element of herd immunity when it comes to this new variant.
All right, Dr. Coley, thanks as always.